People tend to think that it's just a few sessions of toa, as people would fondly call it, but it's not always the case for most people. So. Hello and welcome to Conversations with Anna. My name is Anna Mukula, and on this episode, we are going to be talking about the journey to motherhood, entrepreneurship, and the different social ills that we face as human beings. So, on this particular episode, we're going to be talking about a condition that some moms are not aware of, and I feel like it's a very important topic that needs to be talked about so that people are aware of these things. So guys, before we proceed, I want to plug you guys with our host for today. We appreciate Pride in Flamingo so much. Thank you guys so much for working with us on our very first video today. So this is a family-friendly resort. You guys can visit them. We're going to share their numbers. They'll be running on the screen. They offer accommodation, conferencing, dining. They have a spa. They do excursion activities. And they also have a new baby. They have an Istanbul cave restaurant, the only cave restaurant in Mombasa. Please visit them. They have Turkish cuisine. I'm sure you guys are going to enjoy. Thank you so much, Flamingo Pride Inn. On today's episode, we're going to be talking about a condition called pre-eclampsia, as I mentioned. But before we go on, we have a beautiful lady here called Queen. She's going to introduce herself briefly because I want to take this short and be the very first person who shares her story on this particular topic.
Thank you so much, Anna, for the introduction. My name is Idel Queen Akotolunya. I'm a Kenya registered community health nurse, currently working at Chuda Sub-County Hospital, Mombasa County. I am a nurse midwife, a passionate one to say so. I've been practicing midwifery for the past 6 years, and this journey has been rewarding. I can say it's rewarding because the first cry of the baby and the healthy mother coming out of the hospital gives me a sense of reassurance, and it's a thank you that the world cannot ever reward me. It's only God who can do the rewarding. Thank you very much.
So thank you guys so much for tuning in, and thank you so much, Queen, for being with us today. So guys, my journey of momhood will not begin right from conception because most people tend to think that conception is an easy thing. It's definitely not an easy thing as well. People tend to think that it's just a few sessions of toa, as people would fondly call it, but it's not always the case for most people. So I'll start by saying that I had this condition called polycystic ovarian syndrome, PCOS, for those who don't know. It's a condition whereby the hormones are imbalanced, and the doctors need to work with you so that you can balance your hormones for you to be able to conceive. So yeah, a time came then that we needed to have a baby, and it was not coming through, and I had to visit a few gynecologists for me to check what's going on, why am I not conceiving. And after visiting the first gyna, I was diagnosed with polycystic ovarian syndrome, and I was given some meds to try and balance my hormones. After a few months, it didn't quite work. For whatever reason, the hormones were not balancing as they should. So we headed over to another gynecologist who we worked with, and fortunately, because of the help of something that, again, most ladies don't know that these things are there, and this is what's the name again? It's called the ovulation kits. Yes, ovulation kits. So these are kits that you get to check your ovulation days, and you work with them so that you can conceive on those days that you're fertile. So with the help of that, I got to conceive, And the journey to momhood started. Not an easy one. Again, not an easy one. I do understand that some people, their journey to momhood, their pregnancy, inakuanga smooth. Lucky for them. It's not always smooth for everyone. So here I am, I have conceived. And hiyo tumeanza zinaitangwa aje? The morning sickness. Wow. Hey, I had the craziest morning sickness. I would throw up everything. Everything that I had eaten, yani, would just come out almost immediately. And I came to realize that I had malaria. And this was after like a few weeks. And I had lost 10 kilos in my first trimester. It was bad. Oh my goodness, that first trimester was horrible. Yani hiyo ndio part unafikanga unashindwa nitatoboa. We are just in the first trimester, 9 months to go, and you can't even handle it. You are throwing up everything. So I get to realize that I had malaria. Nikapewa dawa. I was told you are lucky, most people don't survive with the malaria, unapotezanga mtoto. I don't know how true that is. So wanapotezanga mtoto. Luckily there I managed. Nikapewa dawa, nikatoboa first trimester. Luckily we traveled. It was in December. We traveled to a country and things get better. When we were there, things got better actually. And I thought to myself, ama labda ni weather ya Mombasa. Like joto Mombasa ni mingi. Joto Mombasa ni mingi. Nausea inakuwa excess. Tukiwa home, it was actually good. But then tuka transition, tukaingia sasa the second trimester. We come back to Mombasa. But on our way, I'm like, oh my God, I'm just praying that tukifika Mombasa, ile nausea nilikuwa nayo, haitarudi. And luckily it didn't come back, thankfully. So we proceed, tukaendelea vizuri, going on clinics. And I remember looking at my clinic book, and this was past 20 weeks, maybe 27 huko. Nilipofika clinic, I was told like, your pressure is not doing well. And this for the very first time, they're telling me that your pressure is not doing well, and you need to be checked again and again. Nikamwambia ni sawa, I'll do that. They send me to another doc ananiangalia, and they tell me you need to check on your pressure consistently. If you live near a clinic, ama hata kama ni chemist, like just pop in, have them check your pressure so that you check on how it's doing. I remember looking at my clinic book, and this book on week 20s, pressure yangu ilikuwa iko juu. Ilikuwa iko juu above the normal pressure. And I'm like, okay, why didn't they tell me then that things were not looking good? Like, you need to check on your pressure. I think that was a negligence from their end, and I feel like that is something that happens quite oftenly, that the nurses or clinics are very keen on such. So yeah, I go home. I remember this day. Now we are at 38 weeks. My dear, I am so puffed up. Mwili yangu imefura. If I show you those photos, you will not recognize me. Acne all over. So week 38 is here. I cannot forget, it was a very rainy day. Very rainy day. I had locks then. So I go take a bike, go to my salonist, nikatengezwa nywele. And since I had been told to always monitor my pressure, from the salon, I pass by a chemist and she checks my pressure, and it is so high. Week 38, day 2. Can't forget. So my pressure is so high. I remember this lady had to use that machine on herself just to be sure this thing is actually working. So she does that, and her pressure is okay. Ananiangalia tena yangu iko still juu. So at that point, I had my gynec's number. Kampigia simu, hello doc, kuko hivi na hivi na hivi, my pressure is quite high. Akaniuliza again, which week are we? Nikamwambia 38 weeks and 2 days. Okay, we need to deliver the baby. Like now. Saa hiyo ni jioni around 6 hivi. I start panicking because what do you mean now? I'm not ready. I'm not ready to have a baby now. Aki nika panic. Saa hiyo nafikiri hata pressure sasa inazidi kupanda. So ndio hiyo mimi nimeshtuka. I call the father to my baby. Hi, uko aje? Niko poa. Nimeambiwa ABCD, we need to go and deliver the baby. Like now. Sijawahi shtuka kama hiyo siku. But then again he comes, we pack. Obviously it's 38 weeks, you've already prepared. You've packed your bags. Even though you're not ready for that day, we are ready waiting. So we go to the hospital and I get a good doctor. They advised me that we need to do a CS. I don't know if vaginal delivery was possible. Maybe you will tell us if it is a possibility for moms whose pressures iko juu, that they can actually do a vaginal delivery. So tumefika hosi. My docs check on me, pressure, my HB. They just do the normal test that they need to do to check if I am actually fit to go to the theater. And they do that. Nimeshtuka. Theater, mimi naenda kukatwa. How is it going to be? I'm not sure. But I have to keep it cool. I have to act as if everything is just okay because tuko hapa. We have to do this. And I have had a story of a lady we actually schooled together and she passed on, yeye pamoja na mtoto wake, because of the same condition. So I do understand how pre-eclampsia, how bad it is. I actually call it a demon because I feel like it is. So there we are. They've checked me up. They've run the test that they need to do, and I am good for the theater. They take me to the theater, deliver the baby, and I didn't hear my baby cry. But the doctor assures me that the baby is okay. The theater is too cold for her. We just needed to put her in a good place. And the good thing is the dad was just out there. So it was a good thing. Kuna kwanga na stories that babies disappear. So it's a good thing that the dad was there, though they checked on the kid, is okay. So this doctor, they tell my hubby that I have lost so much blood. So I didn't get to know about this particular one until later on. So they tell him that I have lost a lot of blood and yeah, they will work on it. So I was given some medicine to try and reduce the blood, the iron meds. And that was working well. So I didn't stay at the hospital for a long time as well. Apparently, CS moms are supposed to stay in the hospital for a few more days than moms who have just delivered vaginally. Sikukaa muda mrefu. I feel like this hospital led a bit of laws that hawangefaa kufanya hivyo. So I'm taken to the recovery room. I'm recovering. My catheter imetolewa. So I need to now try and go to the washroom on my own without the help of the catheter. I don't remember very well, but I feel like I didn't use the washroom for, I think it was a day that I was there. I didn't use the washroom. I could click ati it was such a big deal. Tukakuwa discharged the next day. Where the CS won't, that's another thing. It was super painful. Super painful. So we are discharged, tumeenda home, we are trying to heal. It's me and the father to my child and my baby. Just the three of us. First time parents, and it was tough. It was tough, but I thank God because my hubby anapenda watoto. So that was a good thing. Angekuwa ni wale wababa wenye babies and them hawapatanangi sababu wengine wanaogopanga wanasema is too tiny, I cannot. Yeah, but him, he was actually very alioshanga mtoto. So I'm grateful for that bit of him. And my sister came over. Luckily, I don't know what we would have done without this girl. Hey, I'm saying that because I needed to go see the doctor like after 3 days, for the doc to check on how my wound is healing. So my sister came early enough, and when it was time to go to see the doc, she was there. So we go to the hospital. I see the doc and I explain what has been happening. I haven't used the washroom for all the days that I was home. And the doc tells me, like, that's not a good thing. That is not a good thing. Even the short call, I'm like, yes, even the short call. Okay, we need to do some tests. I'm sent to the lab. I say luckily, I say I am. It's a good thing that my sister was around because she could help me with the baby. Can you imagine me going hizo raundi zote to the lab kufanya nini na niko na this very tiny baby, niko na wound, I'm still healing. This is just 3 days after this, yes. So we go to the lab, do the tests. The doc tells me I'll be leaving this premise. Look for me in town. Pale posta, he has an office pale. Look for me in town with the results. Sawa sawa. Tunaenda tunafanya test yetu. We did not understand. Kama kawaida unajua test hatuwezi elewa hizi test zinasemanga nini. Sisi ndio hao tumetafutana na daktari. So we get to see the doc at around 4-5 in the evening. So we give him the results and he looks at them and anatuulizanga, kuna hii swali yenye unaulizwa unatumianga insurance ama hapo ndio unajua it is serious. So tukamuza kwani what's up, mbona sura yako imechange? Akaambia the results don't look good, you actually have something inaitwa kidney injury. Again, panic mode. I thought this was just supposed to be kupata mtoto. Tumeenda hadi kwa kidney injury. So doc akapigia simu another doc who is a specialist with the kidneys. So we go see this daktari. Iyo majioni, what he does again is insert a catheter. Once again, because he's wondering, why is it that you've not been able to pass urine all those days, and you're having fluids, you're taking water, unakunywa uji, you're taking all these things. It's not good that you're not even feeling the urge, So they insert a catheter on me and urine comes. Na sio kidogo, quite some amount. So the doc tells me, so he confirms that now you have an acute kidney injury, we need to do dialysis on you. Well, again, I'm like, my goodness. Kupata mtoto ilikuwa kazi. Tumepata mtoto, pressure ndio hiyo. Now we are on kidney injury. We need to do dialysis. This is just too much and it's happening all at the same time. Do we have a choice? We have to save the kidneys. We go get admitted. Yani hiyo siku ilikuwa mrefu. We go get admitted. Hiyo usiku. So the next day in the morning, process ya kufanya dialysis inafaa ianze. Again, I had done a test the previous day. They check my HB, it's at 6. 6. I cannot do dialysis, damu ikiwa kidogo hivyo. Another thing is I am a blood type O negative. O negative. Hiyo damu wanasemanga ni gold. Hiyo damu wanasemanga ni gold. Haipatikani rahisi. So damu yangu ni kidogo. I need to do dialysis as soon as possible. And none of my family members, at least those who are around, in fact, none of my family members, my dad, my mom, my siblings, wote ni O positive. Mimi peke yangu ndio O negative. So we start on another process ya kutafuta damu. And the hospital that I was in didn't have that blood. So luckily a neighbor of mine had the same blood type. She came and gave me blood. Simu zikapigwa Makadara. I remember my mom-in-law made a call to a friend who works at Makadara and nikaletewa damu. And we did some WhatsApp messages. We are looking for blood. And God just came through. That's what I can say. God came through, and the nurses in that hospital were just wondering, like, who are you? How are you getting this blood? How are you getting this blood so quickly? Tunatesekanga kupata hii damu tukiwa na wagonjwa. Like there's a day tulishikanga hadi nurse wetu tumtoe damu sababu it was bad and a patient really needed that blood. You must be so lucky. Nikamwambia tu ni God ndio anasababisha hiyo yote. So I get blood, kuwekewa catheter hii sasa ya dialysis nayo is a whole other story. A whole other story. Nakumbuka wakijaribu kuniweka huku pipes. Na sasa hiyo hujadunga hata sindano ya ganzi. Hapa nilikuwa natafutiwa huku, and then finally walikuja kuweka hapa. So they finally get somewhere wanaweza weka hiyo nini, na I go to do dialysis 3 sessions in that 1 week. Thank God that my kidneys are well. I thank God because I am off meds, the pressure. I do understand that some moms get pressure during pregnancy and they have to use their medicines like for the rest of their lives. It's so unfortunate. But nashukuru Mungu sana because of where I am. My baby is well. I am well. I am healthy. I got to get another baby. That's another story. But my second pregnancy was quite the smoothest. Never got even nausea hata siku moja. So I am really thankful for that. And the reason as to why I brought you here, Queen, today is so that you can, I know you have a story as well of pre-eclampsia. You're just going to give us a little bit of that story. And also, you are a nurse. I wanted you to take us through just a few points of discussion and just let us know what exactly is pre-eclampsia. What exactly do moms need to be aware of? What can they look out for in their pregnancy journey?
Okay, thank you so much, Anne, for your story. Your story is really touching. Keeping in mind, we have said preeclampsia is a demon that we wouldn't want any woman to undergo through. And when you get pregnant, you expect to have a healthy baby and to come out healthy and strong to be called mama for the first time. So I'm also a victim of preeclampsia, but mine was recognized early enough. I was put on medication. I did not go through all that you went through. Early detection of preeclampsia is really something that can help one not go through the devastation that you went through during that time. But it's sad enough that most of our mothers really do not accept that preeclampsia exists. There's usually the misconception of, no, pressure yangu imepanda, niko na fikra, niko na mawazo, pressure yangu imepanda sababu ya labda nimetembea haraka nikafika hospitali, my BPs rose because of one, they always have an excuse and do not want to admit that they are preeclamptic patients. Keep in mind, every woman is at risk of preeclampsia. You can have a healthy pregnancy, the first pregnancy, second pregnancy, third pregnancy, and the fourth pregnancy, you develop preeclampsia. To sum it, preeclampsia is a multi-system condition. Multi-system meaning it affects different systems in the body with no etiology cause. It has no cause. Any woman is at risk of getting preeclampsia. And the B signs that we usually notice with it's the blood pressure, which is the obvious baseline data that a woman takes during the antenatal clinic. And further, there's some tests you'll be done after the BPs have turned out to be high, but they're supposed to be after 2 occasions, 4 hourly apart. That is why when you're told to go home, you're told to go to different clinics or a nearby hospital to go and be checked your blood pressure. So they need to be some hours apart and 2 or more sessions. That is when somebody can come to a conclusion that a pregnant woman is exhibiting preeclampsia, plus some laboratory findings normally proteinuria, that means protein in urine, plus. It means your kidney functioning is not okay. Your kidney is not supposed to sieve out the protein from your body. The protein is supposed to be used in building. Proteins are body building. They're supposed to build your body and for the baby. But in preeclampsia, it is sieved out. That is the reason as to why, when it is sieved out, there's something called oncotic pressure in our bodies that help our cells become large. When it is sieved out, it comes out of our cells inside the cells to the outside cells. That is when you find somebody becoming puffy. Instead of it becoming inside the cell, it comes outside the cell, extracellular. That is when you start becoming puffy. Your oncotic pressure in the body is reduced. So whenever a woman is diagnosed with preeclampsia, there's usually mild and it develops gradually. And before I go into that, there are risk factors to preeclampsia. There's some risk factors. Number one, if you have had a history of preeclampsia before, it means it might reoccur again because your body had already been sensitized to some antigens, meaning it might reoccur again, but it's not a must that it occurs, but you're at a risk factor. Number two, it's maternal age for delivery. If you're below the age of 20 or above the age of 35, you're at a risk because your cells in the body and the blood vessels, when you're below 20, the cells are not that much developed. And when you're above 35, your blood vessels have started aging. So there's that concept of it might cause. Risk does not mean it will cause, it means it might cause. Another one is somebody who has suffered from hormonal imbalances, like the one that you said, polycystic ovarian syndrome. You are at a high risk of getting preeclampsia. There's another one, the extrauterine activities. Women who undergo in vitro fertilization, their bodies were not prepared maybe for that fully, and when you are done the IVFs, you might get that risk. Another one, people with comorbidities like diabetes, hypertension per se. Someone with hypertension can easily get preeclampsia. Another one is also when you have something like hydatiform molar pregnancy. The hormones are not fully balanced, and it's the hormones in our bodies that makes the pregnancy become smooth. It detects how the blood vessels constrict, how the blood vessels dilate. And with the molar pregnancy, there are some things that are produced that are not favorable to the human body. And one last one that is very controversial, change of male partner. So we have seen that a lot. Change of male partner is a greater risk for preeclampsia. And when you take good history from a woman, if they've had one partner before and they change the partner, most of them have the preeclamptic features. Yeah, it's still under research, and people say when that partner, maybe the mother had preeclampsia, the boy, the man, yeah, when that man had a mother who suffered from preeclampsia before, there's a certain antigen that they carry along. So luckily, or let me say unluckily, when you come across and be intimate with that man, you might be a candidate for preeclampsia. So change of male partners also is a risk factor for preeclampsia. And the signs and symptoms of preeclampsia, and in short, I will call it PET. When you're hearing me saying PET, I'll be meaning preeclampsia. The one common sign is edema, generalized edema. Edema occurs in different parts of your body, but mostly the lower limbs, because at the lower limbs, there's usually a poor venous return back to the heart. So unapata mtu amefura mwili mzima, ni mjamzito lakini amefura. Ukimuuliza kwa nini, the woman might think ni kuongeza kilo, but no. If you find that, you have to rush to the hospital, or during your antenatal care, talk it out with your healthcare provider. The second sign is headache. Because of the blood pressures being too high and your blood vessels are constricted, someone tends to have a headache because the blood pressure is passing at a high speed, and at the head region the blood vessels are usually compacted, so you find a woman complaining of persistent headache that is not reduced even by any pain medication. There's usually also a sign of blurry vision. Remember, we're talking about high blood pressure. The blurry vision comes by when the blood flow is high to your optical nerve region, and when it is high, it tends to cause a defective vision. So a woman will also complain of blurry vision. There's also a sign of confusion. The rush of blood in your body is not adequate to different parts of the body. Remember, I talked about it's a multi-system condition that occurs in different parts. So when your body does not get enough blood flow, maybe to your heart, to the kidneys, to the liver, different parts of your body, even to the brain, a woman will start complaining of confusion. And then there are other signs, that those signs that will be done through the laboratory. We'll be checking your urinalysis, we'll be checking your lactate, we'll be checking your glucose level. A lot of things are entailed before someone is told this person is a sure candidate for preeclampsia. Now for the management. The common management that is done immediately when you come to hospital and we notice that you have preeclampsia is start of antihypertensives. They are common tablets that are usually tiny, zinaka kama flagyl. A woman is given fast, and there's always another one that is tiny, nifedipine. A woman is given. Those are prescribed by a doctor. And after that medication is given, we'll have to monitor the blood pressures during that antenatal period. And do not stop taking the drugs tafadhali. Watu husema dawa zimeisha, mwingine husema najisikia niko salama. Hapana, do not zimenipatia nausea, kazana. They have side effects, but for the sake of your baby, continue taking the medication. And when the blood pressures shoot high, there's also some intravenous medication that the doctor can decide to give you, like hydralazine, there's labetalol. Those are prescribed by the doctor, and those are given keenly when you are admitted in hospital. It will have come to severe preeclampsia. So preeclampsia, as we said, is a demon, and a demon does not cause good things to a human being. There are things that it causes to the mother and to the baby. And for the management of preeclampsia, there are things that we denote. 5 major things. 1, we need to prevent or treat seizures. Seizures come about when the preeclampsia becomes too much. It will result to eclampsia. So we do not want it to go to eclampsia. We prevent by the medication that will be given, or treat the seizures if it will ever occur, of which these days we try as much as possible as healthcare providers not to reach to that extent. Number 2, blood pressure control. Blood pressure control will be through the antihypertensives that I've talked about before, the nifedipine, aldomate. Ensure to take them as prescribed. There's adherence and compliance. You will only adhere as per what I will have told you as a healthcare provider, but compliance relies on you, the woman who is suffering from the PET at that moment. So please comply with the medication so that we can save you and the baby. Number 3, we will do fluid management. As much as you are puffy and you look puffy, it does not mean that your cells are healthy. No. There's fluid management that you'll be given. Maybe you'll be put on low salt diet. There's some fluids you'll be told to prevent taking, maybe carbonated sodas, something that has citrus, acidic things because of the epigastric pain that you might also be feeling. So there's some fluid that you'll be taught about. And then there's delivery. The moment you have PET and you have reached term, 34 weeks gestation, plus, and you have severe complications or severe symptoms, the doctor will advocate for you to be taken for emergency cesarean section. But this does not mean all mothers with PET have to deliver via cesarean section, as Anna had asked me before. Some women go into normal labor, but there are things that we look at. First, your blood pressure has to be within the normal ranges. This will only occur if you take medication precisely. Second, we will look at the size of the baby. You cannot have a big baby and we expect you to go into normal labor. It's a 50-50 chance and you're already at a risk of something. We wouldn't want to add two risks together. It will not be fair to the mother and to the baby. Third, there's usually the ultrasounds that are done. So the doctor will look at something called the amniotic fluid index that shows how the blood is flowing and the amniotic fluid is flowing inside the uterus of your baby. And if the AFI, the amniotic fluid index, is okay, the doctor will give a go-ahead for you to go into normal labor. And then for deliveries, if you've had a previous delivery, the doctor can give you a go-ahead. But for a first-time mother with all those complications, some doctors opt not to give a go-ahead for normal delivery and would prefer you go into cesarean section. Why is this? When you are going into labor, you already have a fight and flight hormone in your body. Remember that fight and flight hormone increases your blood pressure. It is already high per se. Physiologically, it's already high. We wouldn't want to predispose you to more high blood pressure occurrence by you going into normal labor. That is why some doctors opt for mothers who have PET to be done cesarean section. So tafadhali, ukiambiwa unapelekwa, watu sema kukula kisu, usikatae. Just take it positively. A CS mother is also a mother like any other mother. A CS mother is a mother like any other mother. And in fact, I say they are champions. It is not easy being cut for the sake of bringing life to this world. God designed us to have a normal delivery. But I say God made you super special. You are like a superwoman. To be cut and a baby comes out of you, keeping in mind you have to control the pressure so that the baby is okay during that whole period, you're a super mama. So don't feel bad because you're done cesarean section because of pre-eclampsia. Just take it positively. Another thing I would like to address on the pre-eclampsia, after delivery, kindly communicate on whatever you are feeling. People are catheterized. People are given blood transfusions. Post-catheterization, Anna had talked about not voiding before leaving the hospital. Talk to your health provider. Make sure you urinate, as we say it. You pass stool. Your bowel movements are okay. Your feeding habit is okay. Your activities of daily living are turning out to be okay before you leave the hospital. If not, communicate to the healthcare provider. Do not stay inside your shell. You're hurting. You've already gone through something so traumatic before, and you cannot say it out. Bring it out. Be open. Be free. And remember, when you're that, you'll give the baby a healthy growth too.
Thank you so much, Queen, for the insights that you've just given us on pre-eclampsia. Thank you so much. I'm sure that was so educative, and we are all about creating awareness. Something I would like you to emphasize on is how important it is for pregnant moms to go for their checkups and their regular clinics. Please tell us, how important is it?
Congratulations, aspiring moms to be and already pregnant women. So it is very important to start your antenatal clinic immediately that you have noted or tested to be pregnant. Start antenatal clinic immediately, even if it is 1 week post your test. Do not wait until the belly is showing. That is when you can go and start your antenatal clinic. No, it is better to start it earlier so that The signs and symptoms can be noted early. If you are a preeclamptic mother, most nurses or healthcare providers put you as a high-risk mother, so you'll be in the clinic of high-risk mothers, but it does not mean that you'll get the PET. There's usually also some supplements that might be prescribed by the doctor, that is vitamin D and calcium, but do not take them if they are not prescribed, because too much of it might cause harm to the fetus. So ensure it is prescribed when you go to the healthcare provider. He or she will do the prescription of the medication, but all in all, ensure, ukijua tu we ni mjamzito, usisite kwenda katika kliniki uanze kupata the services that are required. Yes. And then to add to that also, when you're a PET mother, ensure there are some support groups that you can join. Post-delivery, mothers go through a lot of traumatic thoughts and emotions. So there are some peer-to-peer groups that you can join. Just ask a healthcare provider around your surrounding. We are very much attached to most of them, and the community health promoters also know where best they can fix you. Another thing is that technology is really growing. We have a foundation called Jacaranda, where they offer free SMS services to any pregnant women or any mother who has delivered or has a child 5 years and below. You SMS to the number 21884. I repeat, 21884. Kwa Kiswahili ni 21884. It is free. Just ask them any question and they'll be ready to answer you anytime, whenever they feel need be. And when they tell you rush to hospital, make sure you rush to hospital, because that will mean you'll be in the danger zone. Thank you very much.
Thank you once again, Queen, so much for your time today. We really do appreciate. Thank you guys so much for tuning in for today's video. We are signing out, but I want to mention that if you have a story that you would like to share with us, we're going to share our email and our number. You can WhatsApp us. Please feel free to share. We are here to hear your story. We are going to create awareness on different topics. We are going to share different entrepreneurial stories with you all. Feel free to reach out to us. Thank you so much and see you on our next one. Bye.